Hi there, I'm Yossi here again from Vitalab, and I wanted to share what I found was a very interesting article that I recently came about. So at Vitalab, we strive to remain industry leaders, and so we're always looking at the literature and always seeing what's out there, and it's always nice to see an article which supports how we've been acting and speaking for many, many years. So I'm talking today about endometriosis, but I'm talking specifically about endometriosis which affects the ovaries. And we call this endometriomas, where a woman develops a large cyst inside her ovary, and the cyst contains the same tissue, which is the lining of the uterus. And so when a woman gets her period, she gets bleeding into the cyst in her ovary and eventually collects a big amount of old menstrual blood inside the ovary. Now we know that these endometriomas don't always cause pain, but when they come about with other endometriosis, they are often picked up by the general gynecologist on ultrasound. And then the first thing we do is we rush to theatre and we take out these endometriomas. Now, what's important to note is that when we remove an endometrioma, we will inevitably remove some normal ovarian tissue. So we strip the endometrioma out if it's done correctly, and that stripping of the endometrioma will remove some normal ovarian tissue. And what this does is it reduces a woman's egg reserve significantly. And we know that a woman has a finite number of eggs. So if she has repeated ovarian cyst surgery, the egg number will reduce significantly until our patients arrive here in our offices and they have no eggs left. They're essentially in menopause because of repeated ovarian surgery. So this article supports that if we see an endometrioma, we should not rush and strip it. We should not rush and surgically remove it. And if we do need to surgically remove it, we should first freeze eggs before doing so. So we should go do a round of egg stimulation, do a round of egg retrieval, put eggs in the freezer, protect your egg reserve before going and having surgery. Unfortunately, it's becoming more and more common that we are seeing patients who have infertility, which comes about through surgery. Surgery for endometriosis, surgery for endometriomas, endometriosis in the ovary, surgeries for benign ovarian cysts that never needed to be removed in the first place. And every time we fiddle with the ovary, we reduce your egg reserve. So please, we're asking patients, ovarian cysts do not need to be operated on routinely unless they are cancerous or thought to be cancerous. And even in those cases, it's important to look at preserving your eggs prior to undergoing that surgery. And that's really what this article is about. Let's stop rushing to do surgery for endometriomas, and if we do need to offer surgery, we should first offer fertility preservation, egg freezing in these patients.